At Metro Hearing and Tinnitus Treatment Clinic, we focus on considering the whole person when deciding how to manage tinnitus. We don't just look at the ear or brain. We strongly emphasize supporting the overall well-being of the person dealing with this. Why is this the only effective way to provide our patients with a significant difference in what they experience daily? This video is about what tinnitus is like and how to deal with it.
For quite a long time now, clinicians who work with many tinnitus sufferers, practically in every professional tinnitus clinic worldwide, have been discussing the need for a reliable and accurate method of assessing tinnitus severity. Researchers have been thinking about the pitch or nature of the tinnitus sound for a while now. As a result, many videos on the internet have been created to help tinnitus sufferers determine their tinnitus frequency. There are many videos containing masking sounds at some frequencies intended to provide tinnitus sufferers with some means of temporary relief just by listening to them. Research findings and countless white papers on the internet confirm the negative effects of masking for extended periods of time. And we, as well as many clinicians working with tinnitus patients, strongly recommend staying away and being very careful when using masking as a way to experience temporary relief from tinnitus noise. Why you should never mask your tinnitus. As you know by now, it's been more than 15 years since we started working with tinnitus patients as clinicians, so we have gained a significant amount of experience in this field. As a result, we have seen thousands of patients in our clinic who come to us for help and hope. Please understand that the individuals we work with typically do not exhibit low levels of tinnitus symptoms that have not yet caused severe problems. In fact, majority of our patients come to us with severe or even disabling tinnitus symptoms, which significantly impact their quality of life. We are talking about those who can't get relief by touching their heads or performing other internet-suggested actions. Yet we are most concerned about those who rely on masking to manage their symptoms, whether for a short or extended period. So to all of these people, we have one important message. Whatever you do, don't try to mask your tinnitus. Masking will only make your conditions worse. Now let us tell you why. For many years, it has been widely accepted that tinnitus occurs in your head, and not in your ears or as a result of a problem with your neck, head, or anything else. But a variety of factors can cause tinnitus, and there is one thing that is guaranteed. When tinnitus begins, nothing can be done to stop it, regardless of whether the main cause is there or not. Simply put, it's like using a device with a push button but no corresponding stop button. Yes, some people who have had tinnitus for a long time can become habituated to the presence of tinnitus noise. The tinnitus that these individuals experience is constantly present and can reoccur at any time if certain triggering conditions are present. But let us go back to masking. Here the explanation is relatively straightforward. Simply put, your brain delivers tinnitus on purpose to your conscience. What will your brain do if you prevent it from being able to deliver tinnitus? It will try even harder. You see, when you're exposed to a sound as loud as tinnitus, or even louder, your brain starts competing with it and may end up increasing the loudness of your tinnitus. What's more, if you have a decreased sound tolerance, which is often the case with tinnitus at a severe or catastrophic level, exposure to sound will negatively influence the tinnitus loudness and annoyance as measured by the tinnitus handicap inventory scale. So, whatever you do, stop masking your tinnitus and use caution when exposed to sounds, especially as they become increasingly intense. We invite you to explore our YouTube channel and view our other videos, including one that provides information about the tinnitus handicap inventory scale. And make sure to subscribe to our channel to stay informed about our upcoming videos. The second part of what tinnitus testing used to be is to determine the loudness of tinnitus sound. The main problem, and what makes this approach useless, is the unique nature of tinnitus itself. Some tinnitus sufferers experience a consistent sound that does not vary in pitch or loudness. This is typically observed in cases of long-term tinnitus, or where individuals may have been dealing with this condition for over 20 years. Sometimes they experience the same sound, which they somehow have gotten used to over time. In fact, they may get to the point where this tinnitus noise does not affect their lives as much. However, on many occasions, they seek our professional help when their tinnitus changes and suddenly becomes so annoying that they are looking for help. There is another crucial part of this dilemma clinicians are facing, and this is a well-known unique characteristic of most tinnitus symptoms people experience. What is it, you may ask? Well, it's a seemingly simple thing. You see, tinnitus can fluctuate multiple times throughout the day and night. It can change loudness, going from low to extremely intense sound. In addition, tinnitus noise can often change its nature or pitch, which may be annoying and cause more anxiety. This is why measuring pitch and tinnitus loudness is not necessarily the best way to learn about the true nature of tinnitus. To make it worse, this type of measurement does not tell us anything about all other tinnitus symptoms, which are often quite extensive and annoying and affecting many aspects of the tinnitus sufferer's life. There are better ways to learn about what they experience than asking people what their tinnitus is like, and asking family members is also not helping much. So, what would be the best way to learn how severe this condition is and its effects on the tinnitus sufferer's life? We are talking about tinnitus handicap inventory. Research has proven this method, and it is widely used to provide an accurate picture of tinnitus. It is known as the only proper method of giving a precise assessment and recognizing the severity of the tinnitus sufferer's condition. According to the American Tinnitus Association, this questionnaire aims to identify and evaluate the difficulties that you may be experiencing because of tinnitus. Results are presented in numbers to identify the severity of this condition. The score goes from 0 to 16. It represents slight tinnitus. Then, scale from 16 to 36 is a mild handicap. Next, 38 to 56 show moderate tinnitus level. And 58 to 76 confirm the presence of what is called severe tinnitus handicap. And eventually, a 78 to 100 score is a reflection of the catastrophic level of tinnitus. The Tinnitus Handicap Inventory Questionnaire is just one of the tools used in the proper tinnitus assessment. After a tinnitus assessment, the sufferer should request information about their level of tinnitus. This is also confirmation of having one of the parts of the proper tinnitus assessment procedure performed.
This is very important that tinnitus sufferers talk about tinnitus with their family physicians. This is what we strongly recommend for many reasons. There are some proven and universal recommended approaches to tinnitus management, therapy, or treatment. They are recommended by the American Tinnitus Association. They are also effective that they are verified and recommended by College of Family Physicians and otolaryngologists in most countries, including America, as you can see on the screen. Tinnitus catastrophic level, based on tinnitus handicap inventory, therapy process, will be outlined and explained. Catastrophic level of tinnitus has all elements causing high levels of anxiety, problems with quality of sleep, low tolerance to sound, where exposure to sound is known to make the tinnitus noise much louder and worse. For tinnitus sufferers having so many difficulties with tinnitus symptoms, we may recommend treatment or therapy, especially if patients qualify and are willing to work with us, following our instructions and doing their part. Tinnitus treatment is recommended mostly to catastrophic tinnitus level sufferers. It is very critical and necessary for the success of the treatment program to address high levels of anxiety and stress caused by tinnitus presence, and very often by some other emotional problems. This part of the highly personalized treatment is provided by a fully certified psychotherapist and registered psychologist.
How can bothersome and persistent tinnitus be reduced and eventually eliminated with a proper treatment? There are three major elements used in this type of tinnitus treatments. The first is designed to provide tinnitus sufferers with the quickest and most significant reduction of symptoms. What often complicates this part of treatment is the presence of decreased sound tolerance or the coexistence of conditions such as hyperacusis, misophonia, or phonophobia. In addition, more difficulties are caused by disturbances within the auditory system, which, for example, may cause hearing loss. So, what do we do? First of all, we need to protect tinnitus sufferers from excessive exposure to sounds. This is why we are using a combination device. It has a unique ability to control the loudness of sounds our patient is exposed to using phase noise cancellation and other features. This way, we can ensure that exposure to sounds will not worsen tinnitus symptoms. And when we work with hyperacusis, we initiate hyperacusis treatment based on using specialized equipment and proven to be effective when it's personalized for our patient protocols. Now, having our patients stabilized, we have to address the high levels of the patient's anxiety and fear, connected or not connected to the tinnitus and other existing conditions. This is a highly personalized part of the treatment, and all professionals, such as registered psychologists and therapists, are using the most effective and efficient approach in choosing specific therapies and ways to make a significant difference in the way our patient feels and is affected by anxiety and stress connected or not connected to the tinnitus presence. After reducing or eliminating anxiety, fear, and stress, and helping the patient feel more comfortable with fewer problems caused by decreased sound tolerance, we now can begin the tinnitus habituation phase. This phase is designed to reduce the patient's awareness and sensitivity to tinnitus, which by itself may not be causing any emotional responses or annoyance at any level. It's worth noting that habituation is not the final step in addressing bothersome and persistent tinnitus at a severe or catastrophic level. Thank you for watching. Stay tuned for our next video. It's going to be more practical and hands-on.